That's a great question, and it's a question and a thought process that almost every dentist encounters at some point in their career. That option is an option of those two choices that's always out there. So really, it comes down to a couple of factors. One is, what if I'm going to buy an existing practice? What am I going to? It's financial. What am I going to pay for that? What am I going to pay for that, and what am I going to get? Versus if I start up on my own. So really, to fairly analyze any opportunity, you almost need to create a spreadsheet. What am I investing in a startup practice that I'm not purchasing from anybody else, and what am I paying for an existing practice? What is the purchase price, and what am I getting for that? So if you literally could create a spreadsheet, an Excel spreadsheet, and put the two side by side, add them up, and you're going to get a total. So for example, if you're going to do a startup practice, a typical startup practice, you may borrow $450,000. Let's say you've been out of school for 3 years, you're an associate, decide I'm going to go out on my own, I have no existing practice base, I don't see any practices in the area that I want to buy. I'm going to set up a new startup practice in a lease space, finish out. I'm going to lease 2,200 square feet. I'm going to borrow $450,000. Ultimately get to 5 operatories, but initially I'm only going to equip 3 operatories because that's what my lending will provide me. I have no established patients, so I'm not going to use 5 operatories on day one. I'm going to have some operating capital. I'm going to have materials, consumables I'm going to need to buy, things like that. But I'm going to have a marketing budget, a startup operating capital budget, and I'm going to project how I'm going to get patients in there. So I'm going to borrow $450,000. I may have debt service of $4,000 a month. My lease payment may be $2,000 or $3,000. That's $6,000 or $7,000 a month. Let's say I'm $7,000 a month in what we call facility-related costs and debt service on the loan and the rental rate. That's what it's going to cost me. I spent $450. It's $7,000 a month. Then I'm going to contrast that to any purchase opportunities. So out there, for example, in a purchase, I'm going to purchase, let's say down the street, Dr. Smith. Dr. Smith is selling a practice. So there's a whole world of people out there that create transitions for their owner. They basically represent the owner. So Dr. Smith is going to sell me, let's say it's a similar size office. He's going to sell a 5-op office that's in 2,000 square feet. And he has an existing patient base. Dr. Smith is 60. He wants to work 5 more years. There's going to be a transition. He's going to transition to me. He's going to introduce all of his patients to me. And at some point, he's going to retire, and I'm going to take over the practice. There's some kind of buyout. So, for example, let's say Dr. Smith is going to sell me that practice that has 2,000 active patients, 5 ops. The equipment is older. He's going to sell that for $800,000. Well, if he does that, it's some kind of phased buyout over time. Actually, my facility-related costs for that might be $8,000 a month. They might be $7,000 or $8,000 a month to take out a loan to buy out Dr. Smith, move in with them, have a built-in patient. Patients already there, ability to generate income probably on day one. Well, I have to balance that versus the new startup. So buying Dr. Smith's practice might be $8,000 a month. Doing the practice on my own might be $7,000 a month, but I have no patients, I have no income existing because I have to get patients in there. I have no staff to build around. Dr. Smith may have staff already in place that I can draw upon in a phase thing. Dr. Smith may mentor me into the profession. So you have to look at it. In that scenario, it may sound like, well, gee, maybe I should go with Dr. Smith. If you like him and it's amenable, you have some kind of, where you can work together, he can mentor you, you can learn from him. Sometimes that's a great deal. If you walk in there and go, gee, I don't want to work here. It doesn't matter what, it doesn't matter what the cost is. It's just, I don't want to do that. I want to go off on my own. I have a vision for how I want to deliver dental services. I just need to do it myself. Well, then you're not going to be drawn to that. But you have to compare side by side what each opportunity is financially and what your starting point is. So I would say there's a lot of purchase. You see a lot of practice transitions where there's purchase practices. We do a lot. We do new facilities or highly remodeled facilities for practitioners in their late 40s, early 50s, late 50s, all the time, even early 60s, for people that want to create an attractive practice that they can transition to somebody else. So they're actually doing it a little bit. They're making an investment, creating some risk on their behalf, taking on more debt at a later stage of their career to create that opportunity, because they know younger practitioners are not going to come to some dated office that's 30 years old and dismal and not a place anybody wants to work. Typically, they're not going to buy that. So it just depends. I would caution people in a area that's underserved dentist to population ratio. They're demographically, it's underserved. There's a high demand for dental services. Well, you probably don't need to buy an existing practice. You can, finish out a thing on your own, keep the costs down. If there's a need for you, if people are, waiting months to get into dentist, you'll have immediate patients. You have immediate patients, and you're not paying a premium for somebody else's practice. In more saturated areas, or in probably areas with more typical demographics, then it's a tough call. It just depends on the numbers, but it may be more attractive to purchase an existing practice, go in with that person. You've got a leap ahead of where you are, starting from scratch, and you can learn, and it can turn into a positive situation. So we've seen both sides. We've seen people do startups, what we call a cold startup, do great. We've seen other people struggle for years in cold startups. We've seen people buy existing practices, do great, transition. We've seen other people get in that same situation and struggle. And it's the numbers. You have to balance, what do I get in a new startup, and can I make a go of it? Is there demand for my services with no existing base? And what am I getting in a new facility, in an existing practice that I'm purchasing from somebody else? What's the deal? What are the financial ramifications as they relate to dental practice overhead and facility related costs? So there's some analysis in there. I hope I'm not making it sound too difficult, but usually with some analysis, spreadsheet comparison, you can make a very rational decision and feel good about it. But it's very site specific, it's region specific, it's whoever I'm buying it from, if I can get along with them, if that's a good opportunity for me, what spaces are available in that area to compare against the practice purchase. But all those parameters come into effect and influence your choice in either direction, and how successful you will be in either direction.